I'm Dr. William Stiles, board certified urologist, and I am the prostate coach and men's health expert. Today we're going to talk about using temperature changes to help your body heal. Temperature changes allow your body to alter how it's working. So just simply putting ice on an area can decrease blood flow, decrease inflammation, and oftentimes when there's an injury, let's say you hurt your knee or your hip, your shoulder, usually early on in that process, that's when you're going to use ice. So for those of you that have had prostate surgery or any other type of surgery, often ice is what is important to use in that first 48 hours to decrease inflammation. After 48 hours, usually it's better to switch to heat to increase blood flow and move those toxins out of that area, increase the blood flow so that healing can occur quicker. So again, using ice and heat in specific situations is better in getting you healed and allowing you to be a better prostate patient and hopefully thrive and do better with regards to your healing. Using something as simple as ice and heat. So that's it. If you know someone that's had surgery and you want to share this video, and just remind them that it's important to use these temperatures, ice and heat, to help your clinical situation. Again, get clearance from your doctor before you do anything. Make sure it's okay that you use these techniques. But that's it. I'm Dr. William Stiles. I'm a board certified urologist and I am the prostate coach, here teaching guys about prostate cancer, benign prostate health, and also erectile dysfunction. So keep watching, hit subscribe, hit like, share it with someone that you think that would benefit from this, and thanks for watching.